Yesterday there were three major updates regarding the coronavirus in the UK. One from the government's medical advisors surrounding the progress of the virus and the readiness of the National Health Service. The second was a speech from Prime Minister Boris Johnson to the House of Commons. And the third was again Mr. Johnson, but this time directly to the British people. So, in this video we're going to break down what happened in each of these speeches, how Britain's fight against COVID is going, and what it all means for you. Yesterday began with an update from the medical advisors. The presentation focused on the current status of the virus in England specifically, but the implications will likely be felt in government action across the UK. That's because, as shown in the government slides, cases have been rising across the UK, with all four countries experiencing sharp spikes in cases, far higher than even the peaks experienced in spring. Although, as Van Tam explained,
bear in mind that this is an apples and pears comparison because our testing capacity in the spring was very much lower. But the key point is that having had a rather flat summer, you can see that from early September there has been a marked pickup.
Also, it's worth highlighting the drop that appears at the end of the diagram, which, as they explained, is due to incomplete data, not cases falling in recent days. So it's clearly a worrying trend, with cases rising across the UK. And while hospitalisations and deaths aren't up as sharply, that's not necessarily all that reassuring, with Van Tam emphasising that
as patients become ill with COVID-19, they don't immediately go into hospital. They don't die in hospital the moment they arrive. And the point I'm trying to make here is that there is a lag between cases when we see hospital admissions rise and when we see deaths rise.
When you look at the exact locations of COVID cases, it's widely unsurprising that higher case numbers can be found in the north, including many cities and regions already experiencing local lockdowns. What's possibly more worrying is this map, which shows where cases are rising fastest, with outbreaks very clearly travelling south. It's not just location that's important though. Age is also key to understanding the outbreak. That's because many people argue that while outbreaks are primarily among young people, it's not a major concern, with many arguing that cases are only rising among those who are least vulnerable. This certainly seemed true a few weeks ago, but as predicted, the virus's growth hasn't stayed with young people, as this slide clearly shows. Each of these 9 diagrams represents a different region of the country and shows the passage of time from left to right. Each row represents a different age group, starting with the youngest at the bottom all the way up to the over 60s. The problem this clearly illustrates is that while a few weeks ago the growth was primarily among young people, this has clearly shifted as time's gone on, with spikes across all age groups as they slowly reach even the over 60s. And it's not just the north either, you can see it happening all across the UK.
As the infection rate has begun to grow across the country, hospital admissions have also started to rise. Since the beginning of September, paralleling that rise in infection in the community that Jonathan has shown, we are starting to see an increased rise in hospital cases.
This shouldn't be all too surprising either. As we've shown, cases are rising across the UK, especially among older people, who are far more likely to be hospitalised. In fact, the data clearly shows this, with the recent rise in hospitalisation being driven almost entirely by over 65. So as cases continue to be transmitted to older age groups, we can expect to see these trends continue to rise across the coming days, putting the NHS at serious risk of being overstrained over the winter.
Now, the NHS has prepared well for this second wave. We have new life-saving treatments. We better understand the type of oxygen therapies patients need. 14-day survival rates in intensive care have improved that we have enough PPE stockpiled to last 4 months. We have extra funding to allow local NHS services to ensure we can continue to provide elective and planned care during any second wave.
Despite these actions, Powis announced 2 new measures being introduced to help the health service.
First, we will be introducing regular testing for staff in these high-risk areas, even when they don't have symptoms. This will help us keep staff and patients in those hospitals as safe as possible. And secondly, we have asked the Nightingale hospitals in Manchester, Sunderland and Harrogate to prepare for this next phase.
Johnson started his speech in the House of Commons on very similar ground, highlighting the growth of COVID and the need for new measures to be put in place.
This morning, the Deputy Chief Medical Officer set out the stark reality of the second wave of this virus. The number of cases has quadrupled in the last 3 weeks. There are now more people in hospital with COVID than when we went into lockdown on March the 23rd, and deaths are already rising. There are those who say that on that logic we should go back into a full national lockdown. I do not believe that would be the right course. And on the other side of the argument, there are those who think that we should abandon the fight against COVID, let nature take her course. If we were to follow that course, Mr. Speaker, and let the virus rip, then the bleak mathematics dictate that we would suffer not only an intolerable death toll from COVID, we would put such a huge strain on our NHS with an uncontrolled second spike that our doctors and nurses would be simply unable to devote themselves to other treatments for cancer, for heart disease, and hundreds more.
So Johnson clearly believes that a hybrid strategy, like the one he's just described, is still necessary. The problem with the government strategy is that while they claim it's successful, it's complicated. With different regions following different rules, it's not always easy to know who's supposed to be doing what and where. So in yesterday's announcements, Johnson attempted to standardise the system with 3 tiers of local rules: medium, high and very high. Medium regulations will apply across most of the UK, with people living in these areas only having to follow the standard rules, most notably no groups larger than 6 and many hospitality venues closing at 10 p.m. The next tier up, high risk, adds some additional restrictions, equivalent to the existing local lockdowns. This tier adds restrictions, including the fact that people cannot mix outside their household indoors. However, outdoor meetings will still be allowed, as long as people still follow the rule of 6.
Most areas which are already subject to local restrictions will automatically move into the high alert level.
The top tier, very high risk, will apply to Liverpool initially. Here, you're not allowed to meet with people outside your household or support bubble, either indoor or out, except in public spaces like parks. So friends could still meet up for walks, but not sit in beer gardens. Speaking of which, pubs and bars will actually be closed in very high-risk areas, unless they offer food, in which case they'll have to serve proper meals, not just snacks, and all alcoholic drinks must be served with food. Also, those in high-risk areas will be advised not to travel out of their area, unless it's necessary, such as taking children to school.
We want to create the maximum possible local consensus behind this more severe local action. So in each area, we will work with local government leaders on the additional measures which should be taken. This could lead to further restrictions on the hospitality, leisure, entertainment or personal care sector. But retail, schools and universities will remain open.
So these are the government's new tiers. And if you're unsure which one applies to you in your area, then you can find out through the NHS Test and Trace app or on gov.uk. However, not everyone was convinced by these new measures, with growing evidence showing that local lockdowns like these don't actually work, leading some to ask why further local restrictions are even being rolled out. Not only this, many, including Labour's leader, question whether the government has the competence or the authority to roll out new regulations like these.
I'm now deeply sceptical that the government has actually got a plan to get control of this virus. We've tried to give the Prime Minister the benefit of the doubt, but it increasingly feels like the Prime Minister is several steps behind the curve and running to catch up with a virus that he has lost control of long ago. It was less than 3 weeks ago that the Prime Minister came to this House. He said then that the measures he was introducing then would, I quote, curb the number of daily infections, that those restrictions were carefully judged to achieve the maximum reduction in the R number. That hasn't happened. On the 1st of July, the Prime Minister told us of his new whack-a-mole strategy to control local outbreaks. 20 areas have now been in restrictions for over 2 months. 19 have seen their infection rates rise, some by very large amounts. So those measures have not worked either. The Prime Minister promised 100% of test results would be turned around in 24 hours. The latest figure, Mr. Speaker, for in-person testing is just 24% being turned around. This serial failure, combined with the repeated leaks and briefings to the newspapers in the last few days, fatally eroded public confidence just when we need it most.
So, those are the government's new plans. What do you think? Is the government doing enough with this tiered system of local lockdowns? Should they be locking down harder to prevent outbreaks from spreading yet further? Or do you think the government has got the balance between the economy and health wrong? Let us know your thoughts in the comments below. As always, be sure to subscribe to the channel and hit the bell icon to be notified every time we release a new video. Special thanks to our Patreon backers who make videos like this one possible. And if you want to see your name listed at the end of the videos, then be sure to back us on Patreon. The link to that's in the description.